All right.
Speech.
Our speaker for today is Assemblyman Jay Weber from the 26th District.
Thank you. There's no applause sign.
Just an exit sign.
Just a laughter sign. Laughter. Thanks for having me up. I've been up here a couple times, talked once before, I think, and enjoyed it then. Look forward to enjoying it now. I want to talk to you about an issue that I've been working on in the legislature, healthcare reform generally, the specific bill that I've proposed called the New Jersey Healthcare Choice Act. It's a measure that I feel very strongly about, very passionately about. I think it can help hundreds of thousands of people in New Jersey, if not millions. And I want to explain it to you, share with you what I've learned about the issue of healthcare reform generally since I've been in the legislature, which has only been about 10 months. And then take questions. I'd like a dialogue with you as much as talking at you. That's never much fun. So if you have a question or a comment, feel free to interject, because this is by no means supposed to be a lecture. Let me fruit.
Yes, sir.
Let me just share with you kind of my observations, what I've learned. I'm by no means a healthcare expert, but if you dig into these issues long enough and keep talking about them long enough and talk with people about them long enough, you start to pick up certain things that start to make sense to you. So, in the beginning, there was Blue Cross and Blue Shield, but only really in the middle of last century did we start to develop the idea of health insurance, paying a set amount of money that would cover illnesses, in the event that we experienced them. And it was an innovative idea. It helped millions of people and helped develop the present hospital system we have and the present healthcare system we have. The free market really controlled. Somebody has some money, they say, hey, I can pay you, Mr. Insurance Man, to keep this money, pool my risk with other people. You can go invest it, make some money on your own, but the money's got to be there for me when I get sick and I need to go to the doctor or go to the hospital. And that system works pretty well. But as you know, we have 50 states, 50 state governments, and as is their role, the state governments have decided to regulate those kind of insurance agreements and arrangements, because the states have a responsibility to protect their citizens. So state regulations sprung up around the country to regulate these policies and said, okay, if you're going to sell insurance to our citizens, you have to do a few things. You're going to have to make sure that you have an adequate amount of reserves to pay out all the claims in case claims come in. You've got to submit to certain grievance procedures. If our citizens have a problem with the way in which you're interpreting your contract, they've got to be able to bring a complaint somewhere, and we're going to arbitrate that dispute between our citizens and the insurance companies. And that role for the states, I think, is appropriate and good, and that way you're not giving your money to a snake oil salesman who takes it, and when you do get sick, it's not there for you when you need it. The problem with state regulation of health insurance programs, though, is it gets very political, and when you get politicians starting to run the contractual affairs of private citizens, they start to impose their ideas of what a good contract is and what a bad contract is, right? So the politicians start putting on mandates. They listen to their constituents and they say, well, now every insurance policy has to cover X disease or Y disease or Z disease. We have very sympathetic cases, and insurance companies, if you're going to sell in our state, on top of all these financial requirements and consumer protections, you're going to have to provide certain coverages, certain mandated benefits. And the mandated benefits are what start to make insurance particularly expensive, and especially in New Jersey. To the point now, in New Jersey, we've lopped on or added on so many mandated coverages that we're probably the most expensive state in the union to purchase insurance. If I were on the individual market today, and I'm not yet, but I might soon be, and I wanted to purchase health insurance, I would have to purchase health insurance or coverage for cervical cancer, or maternity leave, maternity benefits in the hospital, or mastectomies. I'm not going to need those benefits, but I have to buy them because the state of New Jersey says every policy in the state has to provide these coverages. But conversely, if you're a woman in New Jersey on the individual market, you have to buy coverage for prostate cancer and other male-related ailments. If you have, if you're a Mormon or you just don't drink, you have to buy coverage for alcoholism. If you don't intend to have any children or have no problem having children, you still have to buy coverage for fertility treatments or infertility treatments. And as a result, you get this one-size-fits-all insurance package that other states have chosen not to mandate, but the politicians in Trenton have decided that you need this coverage because they know what's best for everyone. And every time you add on that coverage, it's like adding on a benefit on a feature on your car. It costs a little bit more money for your premium every time you add a disease or a procedure or a treatment. So, whereas some states have allowed their citizens to purchase insurance policies and negotiate over what riders they want for infertility treatments or cervical cancer, whatever it is, New Jersey has forced these coverages on us. And you might think of other states allowing you to buy a Ford or a Honda or a Cadillac, if that's what you wanted to buy in terms of your health insurance plans. New Jersey only lets you buy a Cadillac policy. You have to buy the top of the line. And I don't know about you, but if my choice now was buy a Cadillac or have no car, I'd probably have no car because I can't afford a Cadillac. And that's what we've seen in New Jersey. We've made health insurance so unaffordable that we have about 1.4 million people uninsured, and we have destroyed the individual health insurance market. In other words, families going out on the market trying to buy insurance independent of an employer. Small employer market has also been devastated by these rules and regulations. That's a little bit by way of background. I want to give you one more piece of history to show you where we were, or where we've been and where we are today. In the early 90s, we had a problem with the uninsured. We had about 1.3 million people uninsured in the state, and that represented about, I want to say it was about 13%, maybe 13.5% of the population back in the early 90s. And one of the theories was, well, there's so many people uninsured because the insurance companies are cherry-picking the good risks, and then the bad risks, the people who are already kind of sick and might cost a lot of money, they're rejecting, they're not writing policies for them. They're out on their own. So the state decided to impose what's known as guaranteed issue. It's no pre-existing condition can be refused by an insurance company. It sounded like a good idea, but it's not for a couple of reasons. I'll tell you why. Along with guaranteed issue in the early 90s, the state gave us something called community rating. In other words, an insurance company could not give you a premium based on your age or your health condition. They had to give everybody in the same pool the same rate. So that might benefit someone who's, say, in his or her mid-50s who might be a diabetic. That his or her insurance might be rather expensive. But for someone who's 25 and perfectly healthy, their rates would be artificially increased so that you're rating the whole pool the same way. Guaranteed issue and community rating have been in place for, about 17, 18 years now. And whereas in the early 90s we had about 13.5% or 14% of our population uninsured, today we have about 14 or 14.5% of our population uninsured. Meanwhile, we had about 400,000 people on the individual market buying insurance from insurance companies back in the early 90s. Today we have about 10,000